Hello, in this video I'm going to be talking about Ribociclib, also called by its brand name Kisqali. What is Ribociclib? Why do we use it? What are the side effects, and is there anything else you should know? Before I go on, I'd love to invite you to subscribe to our channel. We put new videos out a couple times a week, so there's always something new to watch. And I want to remind you, you can go to Yerbba.com to get your personalized Yerbba report. So what is Ribociclib? Again, the brand name is Kisqali. Ribociclib is one of a class of medications that were developed in about 2017 and are used in the treatment of estrogen receptor positive breast cancer. It belongs to a class of medication called the CDK4/6 inhibitors. So CDK4/6 inhibitors, you'll often see them written. And Ribociclib is one of the three that we use. Ribociclib, like all CDK4/6 inhibitors, is taken by pill. So even if somebody is receiving injections of hormonal therapy, this is given by pill. And it's given in different schedules depending on how your body tolerates it. So it's generally given quite a few days in a row with a break. I'm not being specific here because your bone marrow may require you to take it at a different schedule. If you are living with advanced or metastatic estrogen receptor positive breast cancer and you want to know if this might be part of your treatment plan and the reasoning behind this, I want to encourage you to go to Yerbba.com to get your personalized report. So these medications are given, especially Ribociclib is given in the setting of advanced or metastatic breast cancer. It can be given with an aromatase inhibitor, or it can be added to an aromatase inhibitor once the aromatase inhibitor looks like it's not working well enough. So interesting. So you can be on an aromatase inhibitor, it's working, then it stops working, then Ribociclib is added, and now everything's working again. So that's a very common scenario. It's very expensive, and a lot of people don't like the side effects, which I'll get to in a moment. So they say, let's just start with the aromatase inhibitor, and then we can always add this later. It can also be given to people on fulvestrant. That's a drug that's given by muscle. There's also a new oral formulation of fulvestrant type medication, and this is given usually after an aromatase inhibitor has stopped working, and the Ribociclib can be added to that as well. So again, it's taken by mouth. You don't have to go in and get infusions. You do have to get your blood work checked pretty often, especially when you start. And that's because of the effects of Ribociclib on your bone marrow. The side effects, I'm going to start with your bone marrow effects. So the most common thing that we look out for that you'll hear about is a lowering of your white cell count. So your bone marrow has cells that are dividing rapidly, and cancer cells are dividing rapidly, and the same mechanism that hurts cancer cells can also hurt your bone marrow. This is reversible, but it can be severe enough that your medication has to be stopped and then reintroduced at a lower dose. And a major concern is with low white blood cell counts, you can be at risk of infection. Haven't really seen this in a widespread group of patients, but it has happened in clinical trials with thousands and thousands of patients, so you do need to be aware of it. And if your doctor calls you up and says you need to hold it for a little while, that's usually why. The side effects you're going to notice are things like diarrhea, constipation, nausea. So why would a drug cause either constipation or diarrhea? We don't really know. Everybody's different, but both of those can occur, and some people get nauseated, though it's not all that common. We've also seen rash, which is not that uncommon. So if you get a rash on your skin after starting Ribociclib or one of the other CDK4/6 inhibitors, it's very likely to be from that medication. Other things we can see are hair thinning, which of course is very upsetting. And in fact, in people on one of the CDK4/6 inhibitors plus an aromatase inhibitor, hair thinning can be really common in up to a third of people. So this is something that we see. Lowering the dose may help, and that can be useful. Another side effect can be abnormalities of what are called your liver function tests. These are your LFTs, or transaminases is actually a more precise term. Things like your AST and ALT. Different labs call them different things, but that's commonly used in the United States and in the United Kingdom. So your blood work that's checked for your white cells will also be checked for your liver. There are a couple other side effects that people report. Fatigue can be substantial. Now that may be because you have advanced cancer, but lowering the dose of the ribociclib can actually help fatigue. So talk with your medical team about this, and it doesn't reduce the effectiveness. You can also have a cough, and if that can either be from an aromatase inhibitor, but it's more likely to be from ribociclib. So if a cough comes up, let your medical team know. The other thing we can see are lowering of blood sugar levels. So if you're a diabetic, this is something to let your primary care doctor know that you're on ribociclib, and that can lower your blood sugar levels. The last thing I want to say is that if your dose is reduced, or you take a break, or the schedule changes, meaning how many days in a row you take it, you are getting the same benefit. It's just that your body is more sensitive. So don't fear that it's less effective because the doses are being reduced. It's really the same for any medication, chemotherapy, pretty much anything. We're pretty strict about tamoxifen and aromatase inhibitors because they've been studied against lower doses. But just rest assured that if the CDK4/6 inhibitor dose is lowered, you are likely, based from what we see in clinical trials, to get the same benefit as if you were on the full dose. I've covered a lot. We do have another video on the CDK4/6 inhibitors that you might want to watch to learn more about this general class of medication. I hope this has been helpful. Put any questions or comments below. We get back to you just as soon as we can. Please be kind. We're people too. I look forward to seeing you next time, and thank you for watching.